The most common side effects that we see with oral medications for erectile dysfunction is facial flushing. You can get visual disturbances as well. You can get dizziness, and indigestion can be quite pronounced. It depends on how much food you have. So if you take it on an empty stomach, then we can sort of reliably say how long it's going to take for you to have an erection. But if you have a big meal, or if you have dinner, and if you have a tablet, you don't quite know that it's actually going to happen at that exact time. And there's a lot of patients that end up having a bit of reflux from PDE5 inhibitors as well. And I have found that that's not been as common with other methods of delivery. In erectile dysfunction, time to action is probably the most important factor in choice of drug. I find that when you reliably know that in 10 to 15 minutes you can have an erection, you don't really have that anxiety that you're gonna have to wait those 30 minutes. And you miss out on some spontaneous interactions when you are meeting your loved one. You almost like put a block there, a 30-minute block before you go for a hug or before you have a kiss, because you might be scared that that erection won't come in the next 10 to 15 minutes. Patients have become quite interested in Spontan. The majority of the patients that I'm seeing nowadays are patients that have failed with other treatments, and men that have had surgery before and they can't hold an erection with Viagra or Cialis, and a big portion of younger men between 40 and 50, who want something that acts quicker. They're usually hardworking people who work long hours and big jobs, and they find that when they have the opportunity to have sex, it's not all the time, and they need that quick acting nature.